All right, good afternoon. So, welcome to this session. It's Grassroots Grant Writing for the Trade for Grassroots Organizations. My name is Alokan Peace. My pronouns are she and her, and I'm the HIV Capacity Building Coordinator at Tennessee Department of Health. I work with the HIV Prevention and Ryan White Part B projects. I am not the only speaker today. We really have a wealth of expertise and talent in the room. So I want to give our other speakers a chance to introduce themselves.
Good afternoon. My name is Mia Sharp, and I'm the Associate Director at United Way under the HIV/AIDS grant.
Hello, everybody. My name is Kim Truss. I'm the HIV Prevention Director.
Hi, I'm Josh Rosenfeld. I'm the Ryan White Part B Director.
I'm Nikki Easley, and I'm the Director of HIV/AIDS Initiative at United Way of Greater Nashville.
All right, and fingers crossed, we're expecting one more speaker from Shelby County Health Department. Hopefully she's not having any technical issues, but when she gets in the room, I will definitely pause to make sure that she gets a chance to introduce herself too. So I'm going to jump right in because this could easily be a multi-day workshop series with the amount of information that we have. So I'm just going to start moving. So the first thing I want to remind people of is that there are lots of different ways to get funding. Government funding sources aren't the only way. There are a constellation of funding sources. An organization is strongest when it has lots of different types of funding. And for grassroots organizations, it's often important to match the type of funding you're seeking with the capacity you have and the goals that your organization has. And that those might not line up with the local government goals, government funding in your area, so you want to look at other things. In addition to funding that comes out of county government, state government, federal government, there are also local and community foundations in your area. There are small niche funders. Maybe these are funders that are only interested in funding projects with transgender women of color or projects with queer youth or a type of project that matches yours. There are national foundations. There are donors that set up that you get funding through them by applying the way you would a grant. And then there are other ways beyond just pulling in financial resources that you could strengthen your organization, which include maybe resource swaps with other organizations or sometimes with government, which we'll talk a little bit about, and space sharing. These are other ways that you can get what you need, even if what you're getting is not actual dollars. So I wanted to remind everybody that government funding isn't the only thing available to you. And you don't want to be just tied to one grant that funds all that your organization does. That's not safe for your organization. It's also not safe for your staff. But diving right into how to write an effective proposal, instead of tips, I want you guys to think of these as steps. And regardless of whether or not it's government funding, all four of these steps will come into play. And often these are steps that we skip. So it might seem like if you do all four that you're taking more time, but really if you carefully decide, read through a couple of different types of ways the application you're trying to tackle, organize how you're going to do the work, and then strategize with a team of people, it will take less time in the long run. So we'll walk through these pieces. So the first is making a decision. Now, when you have a grassroots organization, people often feel they're doing you a favor by emailing you grant opportunities. Like, you should apply for this. I just saw this and I thought of you. And that can feel like a favor, but it also takes time to evaluate them all. And if you apply before evaluating, you're wasting time. And you don't have time, people, power, and resources to waste chasing lost cause funds. So you want to have a way that you quickly assess grant opportunities before you get excited about them. And then you also want to make sure that you're thinking about the decision-making process as one that involves more than one person. Your grassroots organization has lots of different types of stakeholders. They should have a place in the decision-making process too. One easy way to assess grants is by looking at their eligibility requirements. They all have eligibility requirements, and either your organization fits or it doesn't. If it doesn't fit, don't apply. It is much easier, and it takes a lot less time to send an email that starts a relationship and lets them know your organization is there and you'd like to partner with whoever they fund, than it does to apply for a grant that you know you're not going to get because you're not eligible. And government applications specifically have some eligibility requirements that often trip up grassroots organizations. These are things like professional insurance coverages. Sometimes the grant will require that your organization have specific types of liability coverage for your employees and your work. They can be really expensive, and sometimes they're negotiable and sometimes they're not, and you don't want to waste all the time and effort it takes to put together a government proposal if you can't negotiate that and you also can't meet it. Another common requirement for government applications is that sometimes they require a match. That might mean that if you ask for $30,000, they expect you to raise $30,000. And if you know you can't raise it, then that's not the right type of funding for you. And then all government grants come with some level of oversight. That might be that they want you to collect and report data on the clients you serve with their dollars. They might want financial records for your organization to make sure that you are stable enough to receive their money. So you want to look at that too. Grassroots organizations often enjoy the freedom that comes with not having that oversight, so you might not be ready to give it away. Don't let me talk you out of applying for a government grant, though, because there are certainly benefits. And one of them is that once you receive some government funding, it is easier to see where the rest of it is. Often you find yourself on email lists or in meetings where they're talking about funding that you might not have realized was there. Things get on your radar more easily. And then all government funding has with it this idea that they want to make each dollar stretch as long as possible. And so it's very normal for government funders to try to help the projects that they fund work with other projects that are funded with government dollars. So that gives you access to resources throughout a larger network. And then government funds regularly allow you to write on holistic costs that are required to do your work that some other types of funds might not let you have. So mileage, cell phone, staff benefits like healthcare, indirect costs, and this might really help your organization formalize how it does its work and get money for things you couldn't get money for otherwise. So these are some benefits that come with writing on that funding. Now, we talked about the fact that the decision-making process includes more than just the person who sees the grant and starts to write. And so you want your board to know, you want your staff to know, you might want your volunteers to know. You might need your local stakeholders to know because you need MOUs from them or letters that they promise to collaborate with you. If you have to write policies and put them in place before you apply, your staff and your board will need to know. So you want them on the page with you before you start to type. Now, I put two tools in the document section that you could download before you come into the room. But if you guys could not find them, here's the website where I was able to locate them. This is just a tool that you can use to quickly assess a bunch of different grant opportunities. If your email is full with 5 or 6 emails from people showing you different grants, you can use this to figure out quickly, do you qualify? Is the money enough for you to do the work they want you to do? And is what they want you to do the same as what you are trying to do? And if the answers to those questions aren't all yes, then that's not the right funding for you. Another tool that can be really helpful comes in the reading stage. So maybe you decide this is a great opportunity, you want to apply. Especially with a government grant, the grant application itself might be large, and that can be intimidating to tackle. So you want to read it 4 different times for different, with different goals in mind. The first time you look through a large government application, you just want to skim it. Look for how it's set up, look for the type of information it has in there, but don't really pay too much attention to the details. Just get a sense of how it's laid out and what you can find there. then take a break, go do something else, come back. The next time you read it, just mark it up. Underline all the words where you don't know what they mean. A lot of times a government application will refer to some national policy or strategy. Click on those links so that you know what they refer to. If it's got a bunch of acronyms, circle them. Often government applications have a whole list of the acronyms they're using, so it's easy to find it once you've marked it up. If you see things that look like they might be a problem or they might take longer than other things in the proposal, mark them up. By the time you read the grant as if you would read a novel or a newspaper, it has already been marked up. You're familiar with how it's laid out. It is easier for you to understand. And then that last run through is just you going back to the grant to confirm details that you might need to confirm. Now, the other tool that I put there for you could come into play when you are in the marking phase. It allows you to pull from the application important pieces of information for later and put them in a place where they're easy for you to find. And then you want to organize. Note the application's deadlines and set your own deadlines. Set them earlier than the application says they are. And then often government applications will have an opportunity for you to meet and ask questions. They might call this the pre-proposal meeting or the pre-proposal conference or the, there are lots of different names for it, but don't skip it. It seems like it takes more time, but actually it will help you understand the process better. And often they tell you little things about making sure that you're signed up as a vendor for the county or the state, little details that as a grassroots organization you need to hear. If there are pre-application steps like a letter of intent, even if they're optional, take them. Sometimes you'll write your letter of intent and the funder will realize that you're not a good fit, but you might be a good fit for something else. That's an opportunity for them to communicate with you. And then they'll always have a way for you to ask questions. Ask a question. And then read all the questions that everybody else has asked and the answers. You might not have realized you had a question about something, but someone else did. All of that information is helpful to you. And they'll put it out there in the spirit of being fair. Prioritize the tasks that are going to take longer, and then share the work with others. So here's a good and a bad example of strategizing, and you guys have probably heard the bad example before. The bad example is you do the writing and I make the budget. A better example is that this person will secure the letters of support. That person will apply for the DUNS and vendor numbers. This person creates a program plan, and that person drafts the budget. You'll notice the better example doesn't include who writes, because you write after you do all those things. The program plan and the budget help you with the writing. And people can chime in on the writing after all the other pieces are there. Often a government application is more about finding puzzle pieces and putting them together than it is writing. And you want to play to people's strengths on your team. Like I said, you want to identify the tasks that are going to take more time and start on them. These can include collaborative agreements, securing key signatures from people, setting up as a vendor, developing internal policies. This is why all those stakeholders need to know that you're applying, because they might come into play. You might need them to sign something or to sign off on a policy you're adopting. Assume everything is going to go wrong if you decided to turn it in the day it's due. And then forgive yourself if you write a grant and don't get the money. I will admit I have cried over a grant that I wrote and I did not get because I forgot some fundamental basics. The grant application is not money in hand. It is not a guarantee, no matter what anybody told you, that you're going to get the money or a certain amount of money. And even if you do get the money, it takes time and it comes with strings. And sometimes the strings are enough that you don't want the money again. And even if all those things are true and you wrote the best application, you were passionate, you made a clear case, you used data, you followed all the instructions, you still might not get funded. Sometimes it is not about how perfect your application is. So forgive yourself no matter what the outcome is. All right, like I said, that could have gone on for an hour, but we did not have time for that. I want to make sure you guys get location-specific information. So we're going to switch gears and talk about applying directly through Tennessee Department of Health.
All right. Hello, everybody. So I'm going to be talking about HIV prevention funding. And this slide was presented at the open plenary for HIV prevention, but this is essentially the funding that we have for prevention. It totals up to 8.2 million, or about 8.2 million for the year 2021. The first section that you see is for state funding, and this is primarily used to fund some staff, also the work of PrEP clinics and health departments, and then also testing and expanded testing services. So those expanded testing services are activities like testing in emergency departments or correctional facilities. The second section is the EHE, or Ending the HIV Epidemic program in Memphis, Tennessee. This will be used to fund expansion in the Shelby County Health Department for prevention services, but it will also be used to put out a request for proposals for community-based organizations and other grassroots agencies to apply for funding. And the amount here is going to be around $830,000. This is probably the biggest opportunity to be funded by the prevention team in quite some time, and we'll talk a little bit more about timelines. But again, this is probably the biggest opportunity for prevention. And then lastly, we have our base grant, and this funds all of our services and staff that we work with in health departments and also our community-based organizations around the state. The priorities here are really set by CDC, and as Alokan mentioned, the national strategies that come out from our federal agencies really drive the work that we're able to fund. So currently, we fund activities such as condom distribution, high impact interventions, syringe services, PrEP navigation, testing, and community planning. Next slide. I also failed to mention in the first slide that our current grants range from about $3,000 to $100,000. But moving forward, we also like to partner with agencies outside of funding. And the ways that you are able to do that is through, one, our HIV testing program. We are able to provide in-kind test kits to agencies. Of course, there is a memorandum of understanding or an agreement that has to be signed in order to utilize those test kits. But it is a good way to kind of get connected to us. And we really do care about your ability to reach priority populations when it comes to testing. So, of course, there are still some stipulations there. For condom distribution, our budget is very limited here, but we do have the ability to provide free condoms to agencies, whether that's through direct partnership with TDH, but also through our distribution agencies as well. And then for capacity building, we do provide training on things such as PrEP, syringe services, and testing. And we do prioritize the agencies that we fund, but essentially these are also available to agencies that we don't fund as well. If your agency specializes in capacity building, and those topics are things that we are looking to learn more about, that is also an opportunity to work with us as well. We do have the ability to contract for trainings for agencies that we do work with. We also have access to capacity building assistance trainers through the CDC. And so we can put in requests to have trainings come to our state with CDC experts. And Alokan, who is leading this call today, is really the person to contact if you ever want to talk about some of those specialty trainings that we could bring here to the state. Next slide. And I see Alokan also linked her information in the chat, so please contact her if you do have questions about that. So as far as funding timelines for prevention goes, the first line that you see is really our base grant. And our base grant typically runs on a 5-year cycle, and our 5th and last cycle potentially will be in 2022. So the agencies that we currently fund we ideally will be funding until the end of 2022. And at that point, if CDC does release a new grant for us to apply for, it is likely that some of the activities that we currently fund will change in 2023. So we will likely release a request for proposals in 2022 for 2023 activities for the next 5 years. The second line that you see is for EHE Memphis, or ending the HIV epidemic in Memphis. And again, that is also a 5-year cycle, and that just started in 2020. So we're really at the beginning of this grant cycle, and we are hoping to release a request for proposals for a grant in the summer of this year. And then lastly, we have in the syndemic listed here. In the syndemic funding really comes from our base grant, and what we're really looking to do within the syndemic is fund opportunities across the state for integration between HIV, STIs, substance use disorder, and viral hepatitis. And we're looking to do 1 award per region that is a project that integrates the access, the assessment, and the treatment of all 4 of those health conditions. And we're hoping to release that RFP sometime this summer, if not sooner. Next slide. And so my last slide is about ways to learn about funding opportunities. The first one that's listed here is for the Tennessee Department of Health. And if you go to this website, you will be able to see all of the grant announcements for the Tennessee Department of Health beyond even the HIV, STD, and viral hepatitis team. The second bullet is a link to sign up for the weekly e-newsletter that's distributed by the United Way. We also include all of our award announcements in that newsletter, so please sign up for that if you have not already signed up for that. The third bullet shows the website that you can go to learn about announcements that are specific to Shelby County. And lastly, I just want to emphasize what Alokan said earlier, which is, of course, please attend those pre-proposal conferences and don't hesitate to ask questions, but also keep up with questions that are asked during the application process. Thank you. And there's my contact information.
All right, we're going to move right along to Ryan White Part B.
All right, well, thank you. And that was, both of those presentations were awesome. Thanks, Alokan. A lot of fantastic information that Alokan presented. All of those tips are very crucial, and certainly pay attention to those. That's really good stuff. And Kim, thanks for presenting that. And that Tennessee government website that was on that last slide is really important for seeing some potential opportunities on our end as well for Ryan White Part B side. So we're going to kind of jump right in. If this was a cupcake, we're going right for the filling versus the outside here, and just tell you about some opportunities that are coming up on our end. First and foremost, our 5-year grant cycle is coming to a close basically this year. So all agencies that we would consider for future Ryan White funding, we're going to be entering into sending out an RFGP this year to solicit agencies that are interested in becoming a Ryan White funded agency. So that's going to happen at some point this year. And I do apologize, but we really don't have dates for a lot of these RFGPs. So, but they will be coming out sometime this year. And of course, we'll try to give heads up when possible. And that Tennessee government website is very crucial for that. Also, our insurance assistance program, or IAP program. This is our big program that pays for Ryan White clients' health insurance, premiums, co-pays, co-insurance, all of those costs. Helps with enrollment into ACA by paying for clients' plans during the year. So that also is going to be coming out for bid at some point this year. Next slide, please. And then there is our HIV Drugs Assistance Program, or HDAP program, and this is for an agency that would provide pharmacy services to receive prescriptions for clients that are not insured, and then thereafter do mostly mail order delivery of prescriptions to clients in their preferred location where they would like to receive the medications that they need to ensure their ARV adherence and viral suppression. So that will also be coming out this year. Finally, I just want to point out there's potential, we really don't know what's going to happen, but with the COVID relief funding that's going through Congress right now, there could be something that comes out for Ryan White to award some agencies to do some COVID relief in relation to HIV care. Obviously, we'll have to wait and see what comes out of Congress, but that's a possibility. Next slide, please. We did want to highlight, it's not just there are 5 parts of Ryan White. So there's Ryan White A and B, and those are grants that are awarded. A is awarded to certain metropolitan areas that have a certain population and an HIV population as well. And that's a HRSA award to a metro government, so you can't apply for those. There's also Ryan White Part B, which I'm the director of, and those are awards between HRSA and a state government or a U.S. territory government to provide HIV services. So once again, you can't apply for those. But there are other parts of the Ryan White program, which I'll talk about right here, which you might be able to apply for to gain some grants for Ryan White. So first off, there's Part F. Actually, there's no Part E, which is a little confusing, but there is Part F Ryan White, and that has to deal with dental programs. And there's one program, the dental reimbursement program is open for a dental provider. It has to be accredited. Dental school, dental education program, dental hygiene program that provides services to Ryan White clients. You can apply for this grant and be reimbursed for some of the care that you provided to Ryan White clients. And this is a great program, and we really hope agencies can take advantage of that in the state. Next slide, please. There's also the larger Part F grant, this community-based dental partnership program, and this is for a 5-year grant for specifically for the same types of agencies, dental schools, dental hygiene programs, to provide care and treatment, oral health care and treatment for Ryan White clients. It is a 5-year award versus that other grant I was talking about is a 1-year reimbursement grant. So this is a little different, but it's only for 12 awardees, but they really try to focus on parts of the country where there is a great need for oral health. And this grant is still ongoing right now. It doesn't really end until 2023, but it does provide a little bit more funding for those kind of oral health services that can be provided. Next slide, please. There is a whole bunch of various technical assistance opportunities that agencies can apply for, and these range on a whole bunch of things from capacity building of various sorts of activities like Rapid Start that is now going through the country right now. What are some ways that agencies can find out, research, and provide lessons learned on Rapid Start? There's recently been awards on the use of telehealth to help Ryan White moving forward. There was an award about improving care for African American women with HIV. So these various technical assistance opportunities tend to be on the smaller end. It might be $100,000 or so, but they're very specific to certain things that HRSA would like to learn about and improve upon HIV/AIDS services for people who are part of the Ryan White program. I should mention too, there's the Part C and Part D grants. I have to admit, I don't know as much about the process for applying for these, but there are several awardees for these grants within the state of Tennessee. Part C is specific to providing outpatient ambulatory care. It's specific to health centers, federally qualified health centers, I should say, that can provide this outpatient ambulatory care to clients. And then Part D is even more specific. It's the same thing, outpatient ambulatory care, but centered on providing care for women, infants, and children that are living with HIV. So that's a very specific grant, but those grant opportunities are available for federally qualified health centers also. Next slide. So final quick slide, we just want to kind of state, and a lot of this has already been stated by Alokan, so I won't repeat a lot of it, but just some key information to think about if you are applying for a Ryan White grant, and that's really to be able to project There's a lot of data elements, mostly for Ryan White grants, but they really want you to project how your program, what results you're going to have in year 1, 2, 3, or however long the program is going to exist. Also, they want you to spell out, like, how are you going to collect your data, verify your data, and report the data. And some grants will be very specific that we want you to report your data out in this method, and others, they might want you to come up with that explanation of how you would collect and provide your data. They'll want you to talk about specifically the impact that your program will have on whether it's a technical issue that you're researching or what kind of care or treatment that you would be providing, whether that's oral health or something else. And then most important, they're always going to ask for how will your grant impact the continuum of care for HIV. So how are your program going to impact testing and linking people to care, ensuring they stay on care and they're adhering to ARVs, and then the viral suppression of Ryan White clients as well. That is any grant for Ryan White, they're going to ask that question. So it's something you're going to have to think about and also be able to spell out. I had a link, I apologize, this was a couple of slides ago, which we'll have to repost, but showing where you can see all of these Ryan White grants. There's a federal website where all of this is available. I'll try to drop it into the chat box, but I tested it out a few minutes ago. It's working just fine, but you should always be able to look at that website and see different opportunities as well for Ryan White. And that's our contact information for myself and Phaedra, our Ryan White Assistant Director. But thanks, everybody, and look forward to answering some questions.
All right, and don't worry about that link. It is already in there. Now we're going to switch gears to United Way.
Good afternoon. Like I said in the beginning, my name is Mia Sharp, and I am going to be tag teaming with Nikki Easley to discuss United Way's process of RFP. Next slide, please. So today we're going to talk about proposal components, tips, time to plan, and questions. Next slide. So for our proposal components, when we release our RFP, we always put in the application to ask for providers to submit a cover page. Within your cover page and in your proposal, we ask you to describe your organizational description, because as Elokin and Josh and Kim has stated, we want to ensure that your organization is in line with the proposal that you're seeking funds for. Then within that, we ask you to submit your program description. There are specific questions in the RFP, in United Way's RFP, when you're applying for specific priority areas. We also ask providers to add a budget. And what the budget does, it ensures that you are asking for what's in that priority area and not over the priority area. And then implementation plan. And what this implementation plan does, it allows us to see how many clients and units of service that you are going to serve. Next slide, please. So also within the proposal components, there's a scopes of service. And the scopes of service, again, it talks about from the demographic side, from age, race, the number of clients that you're going to serve. And then we have the work plan. The work plan also details out each month how you're going to implement your program. And we also ask for you all to provide supporting materials, which is the letter of support, your resumes, memorandum of agreement or understanding, letters of assurance, proof that you are a 501c3, and bylaws, and etc. So go ahead, Nikki, I'm sorry.
Okay. So another key component is to be able to sell your proposal. Make sure that your description is tight and as descriptive as possible. You want to always highlight what makes your project stand out. You want to make sure that you are creating a really good first impression, and also why your project is important to the work. Next slide, please. So another part of proposal components is to make sure that you clearly state your goals and objectives, have focused and achievable goals and expectations. How will success be measured when you're writing your proposal? Also, make sure that your budget amounts are realistic for the proposed project. So don't ask for more than what is needed for the proposed project. So tips just in terms of writing an overall really good proposal and just making sure that you adhere to the guidelines in the RFP. First and foremost, do not exceed the page limits. This is very important. Typically, we use volunteers, and they will mark your score lower if you exceed the page limits. Ensure that all signatures are included on your proposal, whether that's your board chair or your executive director of your organization. Make sure that the data throughout is consistent. As Mia stated, we do require that you submit an implementation plan and scopes of service form with your proposal. And oftentimes that requires you to list the number of clients that you plan to serve along with your units of service. So make sure that what you put on your scopes of service and what you put on your implementation plan is consistent with the data that you've also included within your proposal. I can't tell you that how many times we've had someone to submit a proposal, and on their implementation plan, it says they're going to serve 30 people. Within their proposal, it says they're going to serve 25 people. So just make sure that the data is consistent throughout. And then the last one will be to make sure that you submit on time. Whatever deadline is given, please submit your proposal on time. Next slide, please. So just time to plan. Make sure that you read the timeline in advance and you are aware of what's required in your submission dates. Submit a letter of intent if that is what is required. With us, we do require a mandatory pre-bidders conference. This is where we go through the RFP and we talk about the mandatory forms that are required to be submitted. Start writing your grant as early as possible and set it aside a day or two. Like start writing on it, and then once you're done with it, just set it aside and then pick it back up in a couple of days and just read through it again with fresh eyes. You'd be surprised of what you will find. And also ask one of your colleagues within your organization to read it and see if they see any mistakes or anything. Next slide. And that's it for us.
All right, so now we would switch gears to Shelby County Health Department, but I think that the speaker is still having trouble getting into the room, and I want to honor the amount of time we have. So please submit your questions for Q&A. We'll go right into Q&A, and if we can bring our Shelby County speaker into the room, then we'll move back to give her some time to speak. But so I know we have one question here. Please feel free to add additional ones. The question that we have, will we get a copy of your PowerPoint? And so the truth is that I don't know that having a copy of the PowerPoint for you all, if you work at grassroots organizations and are trying to write grants, would be helpful. The links in the chat are more helpful because this is static information that's true today, but a lot of these things might change, especially around funding timelines and when applications will come out. You want to be looking on these websites and watching for the applications to come out. So the links are much more helpful than the slides themselves. Then I'm looking, I don't see any other questions, but I want to give you guys time to put them in. You can either use the Q&A or you are welcome to also use the chat box. For the speakers that we have, if there is something that you would have said if you had more time, now is the time.
Just something to go back to, which Alokan pointed out, but I think it's a very critical thing to keep in mind, is especially for federal funds, is that there is a pretty extensive policy for oversight, audits, things of that nature to make sure that you're complying with federal standards on how funds are being utilized. So something to think about if your agency has the ability to do audits, or if sometimes even hiring independent organizations to do audits for you about how the funds were utilized. So that's something to consider. I think on the federal side, it can be a little more rigorous than in other situations. So, but it's something you'll have to consider about the effort and kind of whether the juice is worth the squeeze right there. I think it's totally possible, but it does require a little bit extra work sometimes.
Excellent.
I have something to add as well. I think it's also important to really take a good look at the evaluation component of the grant application. Even if it's not with the state, well, with the state, we do have to clearly state what we're evaluating and what points we're going to associate with each piece of that evaluation. And sometimes when those applications are scored, it can come down to just maybe like a half a point that determines whether or not you are funded. So I think it's just really important to take a look at that piece and even maybe score yourself and see if you met all of the components of the evaluation.
Absolutely.
And I also
true.
wanted to add, I'm sorry, go ahead.
No,
Okay.
go on.
I just wanted to also add, just in terms of, proposal tips, is to just make sure that you pay attention to detail and make sure that your font is consistent throughout. We get a lot of proposals where people have copied and pasted and the fonts are off. So if you could just make sure that your font is consistent throughout your proposal, that would be great. And that would also, help with scoring.
Yeah, for all HRSA grants, I'm going to tell you Times New Roman 12. That's what they want. There's no deviation from that. So sorry, no 11 font, no like Arial or anything else. That says it pretty specific in their directions. And that's a good point, because especially in very competitive funds or grants, you could actually receive negative points or even just be disqualified for not using the right font or the right size fonting.
And I would add that, like Nikki stated, when you're copying and pasting, please make sure that you're copying and pasting and changing the language in that section for that proposed question. Because you might, feel like, oh, this goes here, but you might have something in there that was in another section. So it's always good to, like she stated, set it down and then come back and watch what you're copying and pasting. And one thing also, when you're copying and pasting, you will get a different font color. So watch out for that too. So, these are just those small little tidbits that you have to have. You go through your proposal with the fine tooth comb, you dot every I and cross every T, and have somebody, like we had stated earlier, who is not associated with it to read it. And do not write your proposal when you're tired. So give yourself a fresh brain and some fresh eyes.
And right now, everything pretty much is either submitted electronically or, we've kind of just moved to really depending upon web-based platforms. So another thing is, if the proposal is due at 12 noon, try not to start submitting it at 11:45. Like, really give yourself time, because what we've ran into is that files can be too large to send, and it takes the agency longer than they originally anticipated. And oftentimes they either will submit it at 12:01, sometimes it gets stuck in our spam and we're just not aware. So I would advise, if your proposals are due electronically at noon, to start submitting them early. I would say 11 o'clock, 11:15, but try not to wait till the 9th hour, because you just never know what last minute issues may arise.
Any look, and that's a good point, to submit it a day or two early, because you might have,
no funders are mad about that.
No, because you might have a funder go through your proposal and say, you know what, you missed this. So, yeah, I agree. Submit it a day or two, because that gives yourself time. If you see a mistake, or like, oh my goodness, I forgot to add a budget, or I forgot to add this form, you can always send your grantee an email and say, hey, I'm going to resubmit because I forgot. So a lot of time is important.
We've got a note in the comments about the fact that sometimes proposals don't make their case as well as they mean to, because they don't use people first language, or they accidentally use stigmatizing language. That's a great point. Remember, all of these proposals are read by almost always a collection of people, a group of people. So if you can go out of your way not to accidentally offend somebody, that's a good thing. And then I don't know that anybody else has brought this up, but one thing I'll say is that sometimes when you know you have a deadline and you're applying for an open active grant, it can feel like the clock is ticking, and that can mean you rush through steps and don't do them as deliberately or well as you want to. You can look at old grants from the government source that you know you're going to be applying from in the future and get useful information off of them. Like, government grants can be intimidating because they're wrapped in a lot of legal language and technical language. And it is often the case that from cycle to cycle, a lot of those pieces stay the same. So if you know you're going to be applying through Tennessee Department of Health or United Way or Shelby County, go find the last grant they put out and see, like, where do I have to sign up as a vendor? What sort of liability coverages are there? What are the rules? How am I going to need to turn this in? So that you don't feel like you need to do that information when you've got a ticking clock and a deadline. You can do some of that research before.
And another thing, you're absolutely right, Alokan. I would, and Mark, thank you for that. I will just add that when you are writing a proposal, please do not assume that your reader knows your program. Please ensure that when you write your program, your proposal, you are writing it like it's somebody you have never met before, and you are explaining it. I've always used this analogy, not to offend anybody. If I do, I'm sorry, but to write it to a third grader's understanding. Because you want to ensure that the individual who is reading it understands exactly what your agency does. And some, we at United Way, we also have agency interviews, but not all individuals allow you to have an agency interview to give you that second opportunity to explain what you wanted to write in your proposal. So always make sure that you stay within your page limit, you stay within your characters of your proposal, but you explain it to the level that they understand, and like the words are jumping off and they can visualize your program in their head while they're reading it.
Just
So
to
Mia,
add
that's
to
a
what
great
Mia
point.
said,
Oh,
sorry, Alokan. Just
no,
to
go on.
add to that, I have been an evaluator for another TDH grant, and I didn't know any of the agencies that were applying. And so that definitely came into play. Everything that I learned about them was on the application, and sometimes there was information missing because sometimes when we write, we do assume that the person that's reading knows who we are. So that's very, very, that's a very important tip.
Absolutely. And I was going to go back to something that Mia had thrown out before, which was have someone who's not familiar with your program read your grant. Often when we get to that phase, we just ask a coworker to do it, but the coworker knows what we're writing about. So they're going to miss things that if you ask a friend at another organization or a family member who doesn't even work in your field, those third parties are going to give you much better feedback.
Somewhat a different issue. Just want to highlight something else. There's a difference between most state and federal grants or contracts. During the RFP process for the state, we usually have a question and answer period. So it's when after we put the RFP out, there's a certain time period when anybody who's interested can submit a question and say, hey, I was reading through the RFP or the grant application and I didn't understand this issue, or what does this statement about how you're going to score mean exactly? And there's a certain time period to send in those questions, and then the agency, like the Department of Health, has a certain time period to write back answers to those questions. Are usually posted on that what should we call it, the grant application website that's in the chat box. which is really good. I mean, that's a great opportunity for people to kind of understand what's in these RFPs, because they're written as best as they can, but they might not be 100% clear. So that's a good opportunity. On the federal side, it's possible. I've certainly seen that before, but it's pretty rare, to be honest. You don't really see that as much, which can be challenging because you're kind of stuck with whatever you got. And there often is like kind of a pre bidders conference or meeting, if you will. But normally there could be a lot of people on the line. There might not be an opportunity to ask any questions. It might just be HRSA or somebody else just going over, well, this is the intention of this grant. These are, turn everything in Times New Roman 12. It's some very basic information. So it's just, it's challenging. And that's why I think what Alokan was saying about going back and looking at past grants to kind of get a feel for what they were like, the kind of information that was used. And keep in mind, you're not limited in most of these grants to just write 100% text. You can put in tables, you can put in graphics, and oftentimes, sometimes they like to see those things. So I really, that's a good opportunity to kind of understand that situation, because you just might not have that question and answer period that we often give you at the state level.
So I'll add there that this was definitely something I had to be sold on, the idea that I should go to the pre-proposal conference if it was not required. Often the funder will require it because they know it's good for you, but you don't always realize it's good for you. And I have been in that position before. But it's also the case that I've tackled government funding applications where within the application it had contradictory information. Maybe they had a checklist on the front that told me all the pieces that I needed, but further in the body of the grant, they listed the pieces I needed again, and there were extras or they didn't match. Like, we're talking about sometimes within your application, things don't match, but truly sometimes within the request for proposals, if it's big enough, sometimes the government body person who put it together made a mistake too, and things don't match. That's the type of information that might come out in the pre-proposal conference. I saw this here, and on this page, I saw that there. What do we do? They might just go on and tell you what they want you to do. That information, if there's anything contradictory or confusing in the application, the pre-proposal conference and the list of questions and answers is where you'll find the answer. And you don't want to be, you've invested weeks into putting a proposal together and your whole team of people have done, all done their part, and you realize at the last minute that you don't know whether the page numbers are supposed to be on the left-hand side of the page or the right-hand side of the page, because on one part of the application it says X and on the other part of the application it says Y. So those things truly aren't a waste of time, even if it feels like you don't have the time to spare.
But look, and I think that goes, I was going to say, look, and that goes back to what you stated. It goes back to the individual or agency taking ownership of reading page by page the application. That is so important. Even if it's a grant that you've applied for before, read over it to make sure that you have everything. And I wanted to go back something to what Josh stated as far as graphs. Graphs are always good. Data is always good, but make sure your data is recent. Make sure that the data that you're using is also correct. So that's a very important piece too.
Some funders will even put in their application that they expect you to go find the most recent data available. All right, there's still no questions. I feel like either we've been very thorough or they just want us to have the freedom to share whatever we want to share. One thing I'll go back and say is that it's very regular for these applications to have some sort of registration process that you have to go through, whether you have to get a DUNS number or sign up as a vendor with local government, something like that, that if you don't do it, their hands are tied, even if they loved your application and your budget and all of these other things. So often that little detail is one of the details that you want to mine the application for first, because sometimes it takes turnaround time when you apply to be a vendor to be approved as a vendor. And you don't want it to be the case that you wrote a perfect application, they want to fund you too, but they can only fund vendors and you're not one of them. All right, so we're winding to the end. Speakers, do any one of you have any last parting tips or things that you want to add?
I have a comment in response to Mark's comment. The In the Syndemic program and Amber in particular has created a document that is about people first language guidance. And so the staff, at least internally at TDH and with the STD, HIV and viral hepatitis program, will have some good guidance. So moving forward, we will be able to acknowledge people first language in our documentation. So hopefully things will get better.
So when that document comes out, it will probably be here on the In the Syndemic website. So I'll put that link out there for you. And for those of you who are writing applications and looking for that best data available, there is a link to the state's HIV data dashboard, which is a good way to pull data that is as current as it could be. All right, well, we don't have any other questions. We really appreciate you all and welcoming us at the beginning and adding little comments along the way. Thank you, thank you. Please know that we are all resources and feel free to reach out to all of us. Then I'll give you all a little time so that you can go and look at what's coming up next and pick the session that speaks to your heart the most. So thank you, thank you.